To think health is to recognize the hidden heroes who ensure medicines move safely from shelves to veins, from prescriptions to healing. It is to honor the pharmacists who insist that adherence is as important as diagnosis. Distinguished ladies and gentlemen, representative of the acting CMB and the CMAC, distinguished assessors, ladies and gentlemen, good morning. My name is Pharmacist Msira Inusa. Today, I'll be sharing with you my reflections on the theme, Think Health, Think Pharmacist. A pharmacist is a poet of science, mixing powders like stardust, measuring hope in milligrams, and selling trust inside a bottle. From dispensers of drugs to pillars of healthcare, we are accessible even without appointment. We are trusted with human lives. We are always present. A patient once asked, "Why do you always smile, pharmacist, when you give me my medicine?" I leaned forward and whispered, "I smile not only because I give you tablets, but because I am giving you tomorrow." Think health, think pharmacist. What is the essence of health? Health is not merely the absence of disease. It is the presence of dignity, freedom, and hope. A pharmacist is the link between the doctor and the patient. We provide dignity in healthcare delivery, freedom through proper treatment, and hope for better health outcome. Every capsule passed across the counter is really a key, unlocking unlocking days of rest and unlocking days of rest and nights of hope that illness tried to steal away. If hope had a taste, it would be the first sip of water after swallowing a tablet. Think health, think pharmacy. The adage, think health, think pharmacist, encapsulates the evolving paradigm of how pharmacists have transitioned from traditional medication dispensers to providers of health therapy. Healthcare providers, we are accessible professionals offering direct patient care. We are educators, empowering patients through knowledge and guidance. We are collaborators in multidisciplinary healthcare. The pharmacist's primary function revolved around accurate medication dispensing and basic patient counseling. Today, the pharmacist is actively engaged in medication therapy management. These are optimal drug regimen, ensuring that each patient receives the appropriate medication for their condition. Adverse effect monitoring, ensuring that adverse effects, side effects are monitored and addressed. Drug interaction prevention. We address different interactions between medication to prevent harm. Enhance patient safety. We improve patient outcome by encouraging and empowering them with knowledge and skill to take active role in their health. Think health, think pharmacist. Patient care. The pharmacists have expanded their role to include direct patient care services. We have become healthcare line providers that's accessible to the community. Our accessibility, often without appointment, makes us available to provide immunizations, administering vaccines and contributing to public health through widespread vaccination. Health screenings. We conduct blood pressure, cholesterol, and glucose screenings to identify health risks early. Preventive care. We provide accessible testing, health services during public health crises, such as pandemics. Chronic disease management. Pharmacists are instrumental in managing chronic diseases such as hypertension, diabetes, asthma, chronic obstructive pulmonary disease, and the likes. This diagram overall shows the role of the pharmacist in ensuring that there's improved patient outcome, reduced complications, and enhanced patient safety. We contribute to the public by ensuring that we advocate for affordability of medicines and accessibility of medications. We provide drug information to healthcare providers. We identify and report adverse drug reactions to prevent harm to the wider population. We educate and empower patients. We advocate for policies that reduce the expensivity of the drugs. Pharmacists are your partners in health. We are not just your drug dispensers, but we ensure that you receive the right medicines. We create moments of connection that heal beyond the medication itself. The future of the healthcare is increasing, evolving drugs, new diseases, advanced technologies. Yet, the pharmacist remains accessible, knowledgeable, compassionate, constant, and invincible in the healthcare system. Today, we remind the world that our hidden interventions, our silent interventions, may not make headlines, but they save lives daily. Thank you.